Sarasota is one of the cities in Florida expected to get hit the hardest. According to its website, Sarasota Memorial Urgent Care Centers closed yesterday as Florida braces for landfall, but emergency rooms are still open. President and CEO of the Sarasota Memorial Healthcare System, David Verinder, is here with more. David, thanks for being here. You know, FEMA officials gave this update earlier, and they said their biggest concern is the storm surge, which is predicted to reach up to 18 feet. So how have you prepared for this?
So we've been in preparation mode now ever since the storm was first identified. We have mobilized our teams. We've mobilized people to make sure our facilities are ready for this storm, to make sure that we can take care of our citizens and take care of our community as we do every day.
What happens to patients who are being cared for? I imagine they would be very difficult to move.
Well, so they're here. We have quite a few patients here right now, and we have probably 3,500 people here in our facilities right now. We mobilized our care teams. Yesterday, locked down the facilities to make sure we had everything that we needed in place. And the people that are here, the patients that are here, are going to be very well taken care of.
David, your county's under a mandatory evacuation order. So what are you most worried about there in Sarasota?
Well, we're worried about the same things that you've probably been talking about. We're worried about storm surge getting throughout our community. We're worried about wind damage. While we have hardened facilities, we certainly have some facilities that are more hardened than others. So when you're talking about a Category 4 or Category 5 storm coming through, it really puts a different perspective on everything that happens. We're very good at tropical storms. We're very good at the lower key hurricanes. This will test our abilities in our facility, but we're here for the community.
The staff that's working in those emergency care centers right now, how are they spending the next several hours as you await landfall?
So right now we're taking care of patients by patient to patient, but we're also preparing. So we are making sure that everything is where it needs to be. Our supplies are where we need to be. And quite honestly, as the storm keeps developing and we keep learning, having more data points around it, we are moving patients out of older areas of the hospital and moving them into more of the hardened areas of the hospital. We're continuing to monitor that in live time and making those decisions as we go along.
And David, I know that you're used to weathering smaller storms or weaker storms. Are you worried hearing about the breadth, the size, the slow moving, and the power behind this storm?
Well, certainly. I think everyone should be worried about it. I think you should take as many precautions as you possibly can. I think at this point in time where we are, we have the patients that we're going to have, we have the facilities that we're going to have, and we just have to make sure that we do everything that we can to protect the community and our public. And I have a lot of confidence in our people, and that's really what matters.
And we have heard throughout the morning that the time for evacuating is now over. For those who are staying behind in this storm, now it's time to hunker down. Within your facilities, is there any more that can be done in terms of preparation at this point?
I don't think so. I think that we have gone through a lot of preparation, but I do want to call out our people. We have, like I said, we have around 3,500 people here right now. These are people who have evacuated their homes or left their homes and left their families and come here to take care of this community. And they have sent their families off to other places. But our people that decide to come and do this, it's a mission, it's a passion, and it's one that we all are very grateful for them to put their lives on hold to take care of people.
All right, David Verinder, we appreciate your time today, sir. Wishing you and your patients and your staff safety throughout this storm. Thank you.
Thank you very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.